moving on to our next speaker, who is Dr. Elizabeth Forsythe. Elizabeth has over 10 years research and clinical experience in Bardet-Biedl syndrome, and she's a huge supporter and advocate for the BBS community. So Dr. Forsythe is going to give us an update on Setmelanotide, which is the first approved treatment for BBS. Thank you so much for joining us, Elizabeth. I'll hand over to you.
Nice to see you. Can you hear me okay?
Yep, lovely.
Great. Okay, let me just try and share my screen. Is that in presentation mode?
Yes.
Great. Thank you very much. Okay, so thank you very much for having me. So for those of you who don't know me, I know lots of people who are on the call, but for those of you who don't know me, my name is Elizabeth Forsythe. I'm one of the consultants in clinical genetics in the National BBS syndrome clinics in London, so both in the pediatric and the adult clinic. And today I'm going to give you an update on Setmelanotide, and I'll talk a little bit around weight and hunger in BBS, because I know it's a mixed audience. So some people who've come to the conference lots of times, and some people might be new. So hopefully this will be interesting and engaging for everybody. So a quick overview. I'll start by talking more generally about weight and hunger and a bit about how Setmelanotide works in BBS. Then I'll talk about Setmelanotide eligibility, and I'll mention some of the side effects that are associated with this particular drug. And then I'll talk more broadly about the sort of practical aspects, like the BBS Setmelanotide clinics that we're starting, and what to do if you're not eligible and you're very interested in sort of further treatment for weight and hunger. But first off, I'm going to start with a bit of information about weight and hunger and Setmelanotide and BBS. And those of you who've been to the conference before will have seen me put up this slide before. It's an overview really of the hunger pathways we have in our body. And it's a big diagram. It's quite complex. And that's because there are lots of different pathways that feed into each other and help our brain process whether we need to have more food intake or whether we need to sort of stop eating. And you can see that there are, on this diagram, what I'd like you to see is that there are lots of signals coming from different parts of the body. That's in the blue section, the lower section, and then coming into the brain. That's in the sort of top gray browny section. And I'm going to focus a bit on the top section here that's in a green rectangle, because this is where all the signals come in. They're synthesized into increasing appetite or decreasing appetite, and that then regulates whether our sort of food intake and energy expenditure balance. And if we look more closely at that, the analogy that I have that I think sort of explains this best is when you have all these sort of signals that synthesize to increase appetite, you also have the ones that synthesize to form a signal that says decrease the appetite. And it's a bit like having a stop button in your brain that says stop, you don't need to take any more food, you're full, and that helps to regulate the energy intake versus output. But in BBS, we know that the stop button, it doesn't work so well. And that means that it's harder for many people who have BBS to know when the body doesn't need to have any more food intake. And people tend to feel more hungry, and that regulation doesn't work so well. And what Setmelanotide does is it works effectively on this stop button to sort of regulate the hunger levels and the food intake levels a little bit more. And so for those of you who've been to the conferences before and in our clinics, you'll know that we have been taking part in some clinical trials. So 2 people from the UK took part in clinical trials for Setmelanotide in the last couple of years, and there are other people across the rest of the world who've also taken part in these clinical trials. And the idea is that when we develop a new drug, we take part in clinical trials, and that process is important in working out whether a drug whether it works, whether it's got efficacy, and whether it's safe. those are the main things. And we took part in sort of in one of the more advanced parts of the clinical trial. And then after the clinical trials, then a new drug has to go through a series of approvals. And in England, we've got the National Institute for Health and Care Excellence. And any new drug that's recommended has to go through a series of committees where they look at not just the efficacy and the safety, but also the sort of financial viability of a drug. And setmelanotide has been through one of these processes, and you can see here, this is from the NICE website. It was published on the 22nd of May 2024, so it's really recent, where they have approved setmelanotide for treating obesity and hyperphagia in people with Bardet-Biedl syndrome, and it's specific groups that they have approved it for. So let's look a little bit about look at the eligibility and very briefly at the side effects as well. So in terms of the people who are eligible for this drug, it is people who are 6 to 17 years old, so children and young people, and they need to be between 6 and 17 when they start the drug. So people who start when they are sort of in their sort of mid to late teens can continue as adults, but you cannot start it as an adult. And it's for people where they are not able to maintain a healthy weight with the usual sort of advice and guidance that we give, so primarily around diet, but also exercise, and they're still finding it very difficult to maintain a healthy weight. And part of the eligibility is also, of course, that it has to be medically safe for the person to have setmelanotide. So there are several different things that we look at in a person's past medical history and in their blood test to see, is this going to be safe? That's obviously very, very important. And for those people where this is relevant, we'll have a much longer conversation around both the eligibility and how it works, and also the side effects. So I've summarized some of the main side effects here, and I've grouped them. So it's what we call a subcutaneous injection. So it's an injection under the skin. And with that, there are injection-related side effects. So it's things like you might get a little bit of pain when you're injecting it. You might get a bit of redness and a bit of irritability on that site. And then there are other things, other kind of side effects that are associated with pretty much all the drugs that manage weight and hunger. So it's things around nausea. Some people get abdominal pain. This relates to how the drugs work, and generally those side effects tend to subside over time. But for some people, they are more significant than for others. Some people don't have those side effects at all, and some people do. And then there's also another side effect, which I guess is more specific to this drug, which is skin color changes. And you can see here are some pictures. So this is a person not with BBS, but with a different condition, where they can take setmelanotide, and you can see the first picture, that's the baseline. So this is what the skin color looks like before they've taken the drug, and the second picture is after the treatment. And you can see the skin is darker there. And my understanding is that it's quite variable from person to person. In the UK, we've only had 2 people on the trial. So I've only seen the skin changes in those 2 people, but my understanding is it is quite variable from person to person how much the skin color changes. But I feel this picture is pretty representative of what I've seen. And the reason why that happens is because the receptor that setmelanotide works on is very similar to a receptor that manages your skin color and the pigmentation in the skin. So there's a little bit of crossover there, and that's why that happens. So finally, I wanted to talk a little bit about the setmelanotide clinics, so the practicalities, and also what to do if you are not eligible, and this is the kind of treatment you might be interested in. So since we've now got the approval from NICE, we are looking to start setmelanotide specific clinics in the autumn of 2024. And as I mentioned earlier, it's people so children and young people between the age of 6 and 17 who are going to be eligible, and they can start it, but then continue into adulthood. The clinics are going to be at Great Ormond Street Hospital and also at Birmingham Children's Hospital. There are some eligibility criteria, and those are around age, but also around whether it's medically appropriate for someone to start on this kind of drug. And the way it will work is that people will have 2 clinic appointments. So the first one, clinic appointment 1, is where we invite people in. We talk about the drug. We talk about it in lots of detail, what to expect, how it works, the side effects, and so on. And then we do a very detailed assessment of each person, so more detailed than what we can normally do when we see you in the regular clinic. And then people go away. We get the results back from the blood test we've done and so on. And then people come back for the second clinic, provided they are still interested to go ahead and they are eligible to go ahead. And then they come back for the second clinic where they do some learning about how to do this subcutaneous injection, and also they have their first dose in hospital. After that, people go home, and there is a home care team who will deliver the drug to your house, and there will also be some medical support, so a possibility to give us a call if you have any questions or concerns afterwards. And then there's a very important bit, which is that this will be we will have shared care with the child or young person's local pediatrician, and that's because it's really important to have someone who is local to where you live in case you have any concerns or any questions, and also because it's important that we look after you and that you're followed up appropriately. So the pediatrician will need to see you after a couple of months to check that everything is going as it should be. So that's a little bit about the setmelanotide, and I anticipated that there might be some people who say, well, actually, that I'm not in the age category, and I'm feeling a bit concerned about that because I'm very interested in looking at a drug that will help me manage my weight. And I would say to those people that actually first of all, of course, there are the non-medical management options, so the diet and the exercise, and we are always very happy to support you with that. And that goes for everybody, both the adults and the children, and it's always our first line. We think that's really, really important. But I would also say that there are other medical options available now. So there are other drugs that are not specific to Bardet-Biedl syndrome. And we haven't done any specific clinical trials for these in people with Bardet-Biedl syndrome, but we do have a number of people who have been trying drugs like Wegovy, which has been in the media quite a lot. And Dr. Fogensteiner last year presented his work on this and showed that actually there are quite a few people who've had this in Birmingham, and they've shown very good results from that in terms of weight loss. So that's very encouraging. There is also another new drug that works on the same pathway as Wegovy, so they work on a different pathway to setmelanotide, and that's called Mounjaro. That new drug is also used for the general population, and I don't think we have any reason to expect that it would be any less effective than, for example, Wegovy in people with Bardet-Biedl syndrome. And those are just two examples. They're probably the ones that are most spoken about in the media and the ones we're most aware of. But there are other drugs, and there are also, the reason why I put several pluses after that is because this is a market that's really expanding. So there are there's lots of efforts to look and develop new drugs for weight management in the general population, which may well be just as effective in people with Bardet-Biedl syndrome. So my main message is, even if you are not eligible for setmelanotide, or it doesn't work for you, or whatever, I think there are going to be lots of options for you available in the future. And that really was my update on Bardet-Biedl syndrome and setmelanotide and weight management.
Thank you, Elizabeth. Are you able to stop sharing?
I will stop sharing. And I'm very happy to take any questions now or later if you prefer.
So we've got a Q&A panel planned for after the next presentation. So that is a significant development for our community, the first treatment as such. And we are delighted that it's approved for prescribing in those aged 6 to 17. But of course, we're all understandably disappointed that it hasn't been approved for use in adults. And I think, you know, we're all in the same position. We're all fully committed to working with the clinicians and the pharmaceutical company and NICE to try and extend that availability.